So with this, may I now introduce Dr. Pradeep Chaubey as the next speaker. Dr. Chaubey is the chairman of Max Institute of Minimal Access, Metabolic and Bariatric Surgery. He is also the president's physician and that also of His Holiness Dalai Lama. I have had the perfect opportunity of working alongside him. And what I admire the most about him is his ability to keep his team together, no matter what the adversity, no matter how good or bad the times are. And I think there's a lot that we can learn from Dr. Pradeep Chaubey. Sir, the session is yours.
Thank you. Thank you very much, Garima. I think it's a great pleasure and honor to be amongst you all. And thanks for that opportunity and the good words you have said. I think at the moment, we all feel that it is like a Rubik cube given to us. And we have just started trying to solve this puzzle. I am not too sure whether the intelligence will pay, but I think it's a lot of things which will be sorted out over a period of time. I thought that I will be discussing about the challenges. And as Ashish has said, I think this is a panic and fear factor. And the fear factor is not only to the patients and their relations, but I think it is true for the doctors, surgeons, and paramedical staff, as well as the administrators. And that fear factor is causing more confusion and adding to the confusion caused by the virus and the pandemic, because we understand very little about this virus. It's a new virus, how it's going to behave, whether it's going to be sustained. But only a few facts which we know about it, that's a heavy virus and droplet infection is the main modality. Hygiene and wearing a mask and covering your eyes is the way to protect. Of course, you have to keep the social distancing. Now, I think as a surgeon, possibly it will be little simpler for us when it comes to the outpatient consultation, because we are doing lots of video consultations and teleconsultations. Fortunately, the government and the MCI and the authorities, which were just lingering it on for so many years, they have really moved fast and given us some ground on which the telemedicine can be practiced. Otherwise, it used to be no one's guess whether we should do a telemedicine practice or not, what are the implications. And that is one fortunate. I think what we have to, according to me, possibly there are certain phases of this apprehension which are going to there. I think once the lockdown is open from Monday onwards, I'm sure we cannot just keep on sitting at home and not operating, as Ashish has just said, that we will have to start somewhere. This is not going to disappear after the lockdown. The worst part of this disease is an infectious disease, highly infectious. We have dealt with a lot of infectious diseases and the pandemics and endemics in the past, but it is very typical of the quick infection which we all get. Also, I think with the modern concept of traveling, we all say that it's a global village. All of us, we are traveling crisscross, even for a marriage, you are going to other country and other cities. And for any dinners and other things also, we all are traveling. We are not staying at home. So that needs to be changed. Now, I think the protection today, we all know that we have to protect ourselves, the medical team and the paramedical staff, but also we have to protect our patients and their relations from mingling with each other. So some of the things which we are trying to adopt is the physical changes in the consultations, and something like what we used to see in bank or in airports, where somebody is sitting across with a glass in between. So I think we have L-shaped glasses and acrylic sheets spread along, so that there's, in spite of all your precautions, we should not get that infection. We have the shifting of the patients is done under the acrylic cover in intubation. I think the most sensitive part is the aerosolization of the body fluid like diathermy, cautery. And of course, we have equipped with expensive gadgets at the moment for conventional as well as for laparoscopy by smoke evacuator, because we know there's a high viral content in the smoke which is produced by energy sources. So those are the precautions. Apart from PPE, we all know that it's very difficult to use, but we have reduced the number of persons inside the operation theater and also their contacts with each other. And we are trying to maintain that social distance. But I think, we don't really like it very much, because doctors and the doctor community was supposed to be very close to the patient and their family, not for operation, not for disease, but emotionally, I think we were very close to our friends. So I think what I'm not liking, which I'm sure it's time will tell us, is the professional distancing. Apart from social distancing, we are now talking about a professional distancing. Otherwise, a pat on the back of the patient or the relatives used to ease the tension and of emotions. I think that probably will be missing. Things will start moving, I think. Unfortunately, I'm happy that from India, I'm one of the person involved in Oxford University and Johnson & Johnson for vaccination program. So we know inside, I think the vaccination will possibly turn it around, and we will feel more safe and the patient will be more safe. Until that vaccination, I think we have to maintain this social distancing and professional distancing, and of course, hand hygiene and use of mask all the way. If there is anything I appreciate, I can try to give some answer to that.
Thank you very much, sir. Particularly as a surgeon, now given Monday, how would you see the surgeries happening? Electives will be restarting. You feel the same way, or there will be some precautions that one would be taking in terms of care for the patient?
See, precautions are a lot, no doubt. But what I'm saying is that those patients who had problems maybe 3 months back or maybe 4 months back, who were waiting for an operation, and now these 50 days are gone and we are not able to offer them, I think I can also say that unfortunately 2 patients developed pancreatitis, biliary pancreatitis, and were ventilated in the hospital, which we feel a little guilty about it. One case was strangulation of hernia. So I think this is the time when we have to strike a balance between the harms caused by the disease and possible harm caused by the surgery. Absolutely. And of course, and also we have adopted this technique that instead of thinking that the patient has got COVID, apart from testing, of course, what we have started doing is we are thinking, and we said, okay, there is a positive way of looking at everything. Right. So we assume that we have got infection and we should not give it to anybody else. So if you take that precaution, it makes you safe.
Thank you.
Everybody around you safe.
Thank you, sir. So I think very rightly said, much like there was an HIV scare before and we started adopting a universal precaution measure, same way probably it is time for us to consider COVID as one such disease wherein again we don't need to fear it, but we need to protect ourselves and the patients both. Thank you very much for that, sir.